Hello everyone, and thank you for watching. If you don't already know, I am currently undergoing electroconvulsive therapy, also known as ECT. This is a decision that I have made after trying unsuccessfully for 22 years to relieve the symptoms of several mental illnesses that I suffer from. I have tried almost every form of psychiatric medication available for my conditions, as well as multiple types of therapies. Even herbal supplements, remedies, things like that. None of which have succeeded. So, after running out of options with medications and therapies, my psychologist referred me to the director of the best local ECT treatment facility. After 2 psychiatric evaluations, a full body x-ray, EKG, a written medical clearance from my primary care doctor, and much blood work, I was scheduled for my first ECT session today. So, during my free time, I was, between the testing that I was doing before the ECT, I was researching about the procedure pretty much obsessively. I tend to do that. So I felt pretty prepared, and I kind of knew what to expect as far as, the procedure and the symptoms afterwards, what it feels like and all of that. The night before last night, I slept for maybe 2 hours. And after leaving behind schedule and feeling like I was running late, I was already extremely anxious on the ride there. By the time I arrived at the hospital and couldn't figure out where I needed to go, I was panicking. Thankfully, I was directed and brought to the area where the electroconvulsive therapy procedure would be administered, and I kind of calmed down a little bit. The area was basically like a recovery room with like curtain partitions. I was put in a bed, more like the gurney style beds, not the hospital style beds. I was attached to monitors to observe my oxygen levels, my heart rate, my blood pressure, and respiration. I was then given oxygen via a cannula, the little tube that goes in your nose. And I also got a shot in my hip to help to relax my muscles. After answering a few short questions from the nurse, I spoke with the anesthesiologist. And then shortly after that, the nurse came in to insert an IV. After some time, a little bit more time than I was comfortable with, because of course I was nervous at that point, but the doctor came in to speak with me, and he explained exactly how the ECT procedure was performed in their hospital. So he explained that every part of the procedure was done in the recovery room, so where I was sitting as he was talking to me, all of it was done there. That's where I would wake up from start to finish. Each patient is prepped. They wait their turn to be given ECT and recover one at a time, and they do 6 patients at once. After he was assured that all of the questions that I had, he had answered, he left my room, and the nurse came back with the sedative to put in my IV. And I must admit that that was the worst part of the procedure. The sedative burned very badly, and burned for quite some time. It was like basically getting an IV of Everclear. The nurse apologized after I was like, how, basically, and said that next time I come in, she will put some lidocaine in along with the sedative so that it won't burn so badly. Well, it'll burn, it just won't feel it. After that, it's still a bit blurry in my head. I don't really remember between the sedative and the next. I just have the next memory, and that was the last memory I had, and that was the nurse and the doctor bringing in the ECT machine and explaining how it worked. Afterward, I woke up with the same feeling that most people describe after having ECT performed. I had no recollection that the procedure had been done and that I was still waiting my turn. I didn't even remember talking to the doctor on the ride home. Never recalled that whatsoever throughout the entire 1 hour that I rode home. But within 30 minutes after the treatment, I did have a really bad headache. Unlike any other headache that I had before, it was more like it was in the middle and the back of my head, and I'd never had a headache like that. So I took some Excedrin migraine, and it eventually went away. And about an hour and a half later, I was experiencing some severe muscle aches, especially in my lower body, lower abdomen, and thigh area, and lower back. I called my psychologist because he's the one that handles all of the medication. The other doctors are just there to perform the procedure. And I left a message with my psychologist to see if there was anything that could be done to alleviate the muscle pain. I've had a side effect of that with the medicine before and was prescribed Flexerol, so that's probably what he'll give me. Hopefully we can find a solution to that before my next ECT session, and that's on Wednesday in 2 days. So, I don't know, I must admit I'm excited to see whether or not this treatment works for me. Typically, most patients don't see improvement until about 4 to 6 sessions. So, that for me means with 3 sessions a week, the potential for improvement by next Friday. I would say that's a bit quicker than 22 years. Everyone that has had ECT done has their own reasons for having it done. My reasons are in hopes, at the very least, to be able to take medications and have them work effectively. And by having the option for the medicine to work effectively, I may be able to control or even overcome my anxiety and panic. I don't even really have words to describe how that would make me feel because I don't know what it feels like, but I am hoping to find out, or at least have the opportunity to try to.